Hello, my name is Dr. Maeve Kenningham from Dr. K's clinic, and I want to just answer a question that has been posed, or a frequently asked question actually in aesthetic medicine. People come to see me because they're very unhappy with these folds that we call the nasolabial folds and the marionette lines here that occur the older we get. Now, in order to offer treatment options here, one has to understand, well, why have they occurred in this person's face? And I want to briefly just go through that, and then I want to just discuss then our treatment options in more detail. So our treatment options are fillers, biostimulators, and thread lifts. So why do these nasolabial and marionette lines occur? Well, it all harks back to what happens to your face as you age. So if we have a look at this mannequin, which shows us on the left side here is the youthful side, and here is the more aged side. And what happens is the eye socket becomes larger, the cheekbones become narrower and become less projection of these arches. There's also a change in the angle of the jaw, and there's shortening of the jawbone as well compared to our youthful side. Okay, the other thing that happens is that our fat pads are deep fat pads. Now these aren't affected by weight, whether you gain or lose weight. These deep fat pads start to deplete in volume even from as young as when we're in our 20s. So here we have the buccal fat pad, which extends down the lateral part of the face, and the cheek fat pads particularly is what I'm talking about here. When these start to deplete and the structure of the jawline and the cheekbone has also become resorbed, what happens is the skin isn't as taut as usual or in your youth, and what happens is your skin falls forward and you get nasolabial and marionette lines. So how do we treat these lines that have occurred? Well, in the past what we used to do was inject these lines directly. Now, unfortunately, that led to a really unnatural looking result where the nasolabial was less creased. It resulted in a heavier, almost masculine looking filling of around the beard area. Thankfully, we've moved away from that. So in order to treat this area really effectively, you need to look at the lateral aspects of the face. So you need to look at the temples, the cheekbone, and these deep fat pads, because if they have been depleted, you need to restore those and bring the skin back in that taut manner, and in doing so you will find that you will need to inject less here, because sometimes we still need to inject the nasolabial fold and the marionette lines, but less so. So we're still retaining that inverted V that we all look for in youth. Our other treatment option are thread lifting. Now, I tend to use COG thread lift in my patients. I use COGs because what I want to do is to basically elevate and lift structures that have descended down the face due to gravity. So how we do that is I inject some local anaesthetic here and often here, and I insert a little cannula and typically for the face I may want to choose 6 threads, and 4 of which will originate from here. So I may put a thread here, 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 and here, and in tightening the thread it causes a upward and backward lift, which again mimics that inverted triangle that we see in youth. I also then, if the marionettes are a problem, also add then 2 threads along here to begin to pull those back. Often with PDO thread lifts, depending on the face of course, if there is deep fat pad loss, for example in the cheeks or in the temples, I may add volume with dermal fillers or biostimulators into those areas to make it a more holistic, rejuvenating appearance. So I hope that's been educational. It's a very commonly asked question, especially the older ladies, asking how do we get rid of these folds, and have been disappointed with treatments that they've had before or elsewhere. If you want to learn a little bit more about whatever cosmetic concerns you have, and want to know the treatment options available, if you go ahead and get into my website, which is Dr. K's Clinic. If you just Google my name, Dr. Kenningham, my website usually comes up. And if you look on the page which says how I can help you, that kind of lists and shows examples of common cosmetic concerns and the treatment options that are available to treat those concerns. And then what you do is then you hop along to the treatment section and find out a little bit more about those treatment options themselves. So I hope that's been educational, and if you want to book in with me, all you need to do is to go to the Contact Me page on my website, and right at the top there's electronic booking. So stay tuned for more information and educational videos on YouTube and in my blog and on my website itself, and I look forward to seeing you again soon. Bye for now.